Hi, this is Dr. Roger Boger. I hope you're having a wonderful day. Last time we talked about integrative wellness, and we talked about that if you walked into your doctor's office and he or she said to you, well, what is it that you eat? How do you exercise? How's your family life? How's your relation to source? All those things. And today what I want to talk about is a very, very important concept. It's called inflammation. Now, inflammation is characterized by having heat, redness, pain, swelling, and loss of function. So calor, dolor, rubor, tumor, functionalis is the way we were taught in pathology at Temple University. So we think about that normally as the way the body heals. You cut your finger and it gets red. That's because there's more blood there carrying the oxygen. It gets a little uncomfortable. It gets a little swollen. And then in a few days you look down and everything is healed because of the mind-body connection. Well, that's the good part of inflammation. But if inflammation is allowed to continue ongoing, it can have a negative effect on your body. For example, if your coronary arteries, the inside, the lining of your heart arteries, get inflamed and stay inflamed, guess what? Cholesterol goes there to kind of patch over the inflamed area because that's what the body does. It's a protective mechanism. So if this is your vessel and you keep patching it over and over and over again, pretty soon the vessel closes and that's a heart attack. And that's all from inflammation. So what do we do about inflammation? Well, one of the key things is to remember a wonderful study that I read about in Roseto, Pennsylvania, called the Roseto Story. And it was about how the people there, all of Italian descent, got less and less heart disease. And it was supposed that probably this came from the red wine, the resveratrol in the red wine. But make no mistake about it, they also ate a lot of garlic. And garlic lowers your blood pressure, it lowers cholesterol, it has a profound impact on your body. Again, your heart needs to stay healthy. Turmeric is another anti-inflammatory herb. The thing is that only 3% of it contains the active ingredients curcumin. So it's probably better to get some curcumin in a concentrated form and make a tea from it. That's anti-inflammatory. I highly recommend that you look at Dr. Andrew Weil's anti-inflammatory diet. You can type it into your browser and look up Dr. Andrew Weil, W-E-I-L, anti-inflammatory diet. It's really, really important. The other thing I want to share with you today is stop. Please stop all the sugar-containing sodas and pops that we all drink. They just load the body down with more and more sugar, and then we treat the symptoms, which is traditional medicine. However, in integrative wellness, what we want to do is we want to find out the cause. Well, the cause of inflammation is, one of them is a high sugar diet. So please stop those sugar sodas. I think that as we move forward in these talks that we'll have together, we'll talk more and more about coming at the cause of the disorder that we call the disease, rather than going at treating the symptoms. I hope you have a wonderful day. I hope you're not inflamed today. I hope your heart is healthy. This is Dr. Roger Boger. Make it a good one.